TMS, or Transcranial Magnetic Stimulation, is a new treatment which has been approved by the U.S. Food and Drug Administration for about the last 3 years. And the way it works is quite different from any other treatment for depression. It is indicated for people that have failed at least one trial of a reasonable medication at a reasonable dose. So the threshold is not difficult to qualify for the treatment. The wonderful thing about it is not a medication treatment, and it is not shock treatment. TMS, on the other hand, is where you basically drive to the facility. You lie back in the chair, this magnetic coil is put next to your head, and you sit there and you talk to the therapist for roughly 37 minutes while your TMS treatment is being administered. It really is, in terms of the brain, it's painless, there's no seizure, there are no medication side effects, it doesn't cause sexual dysfunction. It is great for pregnant and breastfeeding women because it does not, obviously, the magnetic pulses don't go into the fetus, and it's also not something, it's not a medication that will be excreted in the breast milk. There's an area of the brain about the size of a golf ball called the dorsolateral prefrontal cortex, and we want to make sure that the coil is over that golf ball size section of the brain to shoot the pulses in there, because that's what is known to have the antidepressant effect. And so, as the brain is stimulated, and as these pyramidal cells are stimulated right under the skull, this sends impulses down to the deep brain nuclei, which cause them to release neurotransmitters globally in the brain, and so you get not only the local effects but the generalized effects in the brain. TMS is right now paid for by some insurance companies, but what I would call begrudgingly. So in almost all of the TMS centers, the patient basically pays for the treatment, and then we help the patient fight for reimbursement from their insurance company. It is not an inexpensive procedure. The interesting thing, though, is many people sometimes just focus on the cost of TMS. And that's true. There's a cost to it, but there is a huge cost if depression is not treated. We're talking about people losing their jobs and all of their insurance benefits. In some cases, their retirement plans, because they're not vested. They lose their marriages, they lose their relationships, they lose their careers because they cannot function when they are in the pit of despair with depression. So there are huge costs associated with not treating it. I think on balance, the cost for treating with TMS is very reasonable for the benefit that you are likely to receive.